Hello, in this video we are going to focus on the deployment of a telemedicine pilot in Senegal, more precisely in the region of Fatick. The main objectives of the project were to cope with the lack of skilled and specialized health staff in remote areas, which is a very common problem in most of the sub-Saharan African countries. We wanted to rationalize the obstetric and neonatal referrals and counter-referrals, on the one hand by avoiding unnecessary referrals whenever a patient could be treated locally, and on the other hand, making sure that necessary referrals were made in due time. In a nutshell, bringing missing clinical expertise in gynecology and obstetrics and neonatology to remote health facilities in the Fatick region. 3 different digital health tools have been deployed, and we will have a closer look at each of them. An electronic referral and counter-referral system, making it possible to exchange patient information between health facilities in the region, a teleconsultation solution, and a tele-ultrasound solution. And these are the health facilities that participated. On the top level, we had the Hospital of Fatick with a well-equipped neonatology and maternity departments. We also have the Sokone District Hospital. It's called in Senegal a health center, but it's a district hospital with only a well-equipped maternity. And then we had first level health posts, one in Karan on the frontier with the Gambia and one in Bedenti on an island that could only be reached by boat. The first tool that was implemented is an electronic referral and counter-referral solution, where we install the Open Clinic Hospital Information System in each of the health facilities. At the center we find a master patient index, which is hosted at the Ministry of Health Data Center. And when visiting different health facilities, a different Open Clinic ID will be generated for each patient on each site. But on top of this, a unique global ID will be provided by the Master Patient Index and will be shared by all health facilities. These are connected to the Master Patient Index server by means of encrypted secured connections, over which patient referral information can then be reliably exchanged between all sites. Put in practice, the local health professional at a referring health facility logs in to the Open Clinic system, opens the patient records and finds the local patient ID and regional or global ID. He creates a referral letter, adds any relevant information for the destination health professional, and in the end will send the referral letter to the destination health facility. In this case, it will be the Hospital of Fatick. You can also add any other relevant clinical information from the patient record if needed and sends the document. It will arrive in a couple of seconds. When the patient arrives at the destination hospital, they will also log on to the Open Clinic system, and there they will search for the patient record based on his master patient ID or his regional ID. They will open the patient records and find the referral letter, the documents that have been sent by the referring health professional. They open the referral letter and will find exactly the same content than the one that was sent by the referring health professional. They can then add, after examination, a counter-referral letter with additional information for the referring health professional. And this counter-referral letter will arrive at the referring health facility way before the patient does, providing useful guidance on further care for the patient. The second tool is a teleconsultation solution. This is based on industrial smart glasses featuring a central camera, a zoom camera, a local screen, and audio devices in a single headset. When this headset is being worn by a nurse, it can be powered by a 4G connected smartphone that also provides internet connectivity. A remote expert A physician or a specialist can then connect to the smart glasses and the smartphone using a unique session code which has been agreed on between the experts and the wearer of the smart glasses. And as soon as the session starts, then the remote expert can start providing guidance to the wearer of the smart glasses on the clinical examination.
Ok, d'accord, ça marche, il n'y a pas de souci. Maintenant, il ne tire pas, il n'y a pas de signe d'interrespiratoire. Tirage d'interrespiratoire, non, il n'y a pas. Ok, ok. Ouais, il n'y a pas de problème, il s'amuse. Ok, d'accord, ça marche. Ouais, on finit par examiner les autres.
A third and last tool in this telemedicine project is the tele-ultrasound solution, featuring the integration of ultrasound images in DICOM format in the electronic medical record, sharing them on a regional PACS server, and providing remote assistance during the ultrasound examination. Images produced by ultrasound devices in the health facilities can be stored in the electronic patient record in the local open clinic systems. From there, they can be easily retrieved and viewed in a DICOM-compatible image viewer for further examination or annotation whenever that would be needed. The locally stored images can then be uploaded to the regional OpenCareNet PACS server, where any authorized caregiver or even a patient can access them for downloading, viewing, or sharing with other health professionals. They have the same DICOM compatible viewer at their disposal on this platform. And finally, combining the digital ultrasound devices with the smart glasses provides a means for implementing tele-ultrasound assistance. This way, nurses in remote locations can be guided in real time by an experienced gynecologist or a midwife in the hospital.
35. Là, tu as fait oblique. Hein? L'autre, c'est 75. L'autre, c'était 75. Hein? Ça c'est plutôt à hauteur du 2. C'est une mesure verticale seulement.
The early results of this project are quite promising. First of all, we have seen a stable technical operation of hardware, software, and network components using quite standard hardware and 4G connectivity. The user adoption was also very quick after hardly 1 day of training, especially with the midwives in the health centers who perceived the system as very easy to use. The solution has been considered to be of great clinical utility by the stakeholders at all levels of the health system, and we noted a significant on-the-job training effect of teleconsultation and tele-ultrasound sessions that have been organized. On the other hand, there still remains a need for a contextualized operations manual that documents organizational aspects of the teleconsultation, such as how to make an appointment, and an agreed-on payment framework treating telemedicine activities as full-fledged health services. Indeed, the demand from health centers for specialist tele-expertise may quickly outgrow the services that can be supplied by the hospitals on a voluntary basis.